Good afternoon, ladies and gentlemen of the media, and to the Bermudian public that are watching at home or listening to the radio. I trust that all Bermudians had a restful and blessed Easter weekend. And today I'm joined for this press conference by the Minister of Health, Kim Wilson, the Minister of Labor, Community Affairs and Sports, Minister Fogo, and the Minister of National Security, Minister Wayne Keynes. We are also joined by the Chief Medical Officer, Dr. Cheryl Peak Ball, who will be able to answer any questions, medical questions, which may come later today. First minister to speak will be Minister Wilson, the Minister of Health, with an update on the latest with COVID-19. Minister.
Thank you, Bernard. Good afternoon, everyone. Today, there were no test results received. However, an estimated 39 are being processed as we speak. Sadly, another individual has passed away, and on this occasion, a senior who had been recently hospitalized. I want to begin by sending my sincere condolences to the family of that individual, and please know that the entire government, as well as the Ministry of Health team, offer our sincere condolences as you grieve the loss of your loved one. Bermuda's total confirmed positive cases remains at 57. 30 have now recovered fully. 6 persons are hospitalized. 3 of those persons are in ICU, and there are 16 persons under active public health monitoring, but who do not require hospitalization. Today's good news is that another patient has been discharged from hospital. The age of persons hospitalized ranges between 67 years and 78 years, and the average age is 72. The average age of all confirmed positive cases is 52. The median age is 53, and the age range of all our positive cases ranges between 18 and 86 years. Out of the 57 positive confirmed cases to date, 31 are males and 26 are females. And as I announced last evening, the Ministry of Health's Epidemiology and Surveillance Unit received laboratory confirmation yesterday of COVID-19 in 2 residents and 2 staff members at the Matilda Smith Williams Resident Seniors Home. Public health actions and contact tracing is actively occurring. Unfortunately, these results did confirm to us that there was spread of the virus within the facility. This is the second care home where there has been a positive case involving staff member, and we are all understand the higher risk as it relates to seniors. And as a result, care home residents and staff at Matilda Smith are being tested for COVID-19. More than 50 people are being tested, and we expect the results within the next 24 to 48 hours. The team is just make sure you bring the mic closer, please. The team is working with all rest homes to ensure staff and residents are as safe as possible. The country's testing capacity will continue to prioritize rest homes and other high-risk persons. The outbreak is being managed by strategies put in place prior to the cases being confirmed, and these will continue, and they include no visitors to the facilities, emphasis on infection prevention and control hygiene practices, enhanced daily monitoring of staff and residents' health, isolation of any symptomatic individuals, and exclusion from work of any staff with symptoms consistent with COVID-19. Enhanced cleaning and disinfection is currently taking place. Disinfecting wipes have been provided by the Department of Health to all facilities. The confirmation of COVID spread at rest homes underscores the importance of our decision as a government to proceed to amend the Bermuda residential care and nursing home regulations to prevent employees from working at more than one site where there is a risk of communicable disease spread. Some private homes have since followed this example. Our residential care homes regulation officer has been communicating with the homes and asking them to stop the practice since March. We hope this will safeguard our residents from COVID-19 by eliminating any potential transfer of the disease among the different long-term care homes by unknowing staff members. We know the sacrifice our healthcare workers are making, both in the long-term care homes and within our community, as unlike many in Bermuda, they cannot shelter in place or work remotely. We are supporting them as much as we can by providing them with the requisite supplies of PPE, regular guidance, and funding for resources as needed. There is no wish to place restrictions on anyone, but in this instance, it is for the safety and health of the community. The Bermuda Health Council is in the process of compiling a list of potential substitutes that could assist with staffing shortages due to the change in the legislation. Since January, there have been extraordinary efforts to prevent COVID-19 from entering our care facilities. This is a global pandemic, and Bermuda has local transmission, and the efforts are highly and rightly focused on managing and containing the spread. The homes have been on high alert since the beginning of the year and have been working tirelessly on preparing and equipping the homes for COVID-19. This started with plans for restriction of visitation, cleaning and disinfecting the facilities, planning for expected staff shortages, training on use of personal protective equipment, and so many more details that have been critical to putting us in a more controllable position. Visitors have been canceled to homes since mid-March, and the staff without symptoms have been provided with masks. The residential nursing home care team has required the staff to take their temperatures at the door. Heightened infection control measures and changes in behavior such as not wearing their uniforms outside of the care homes are also included, and residents would also have their temperatures, blood pressure, pulse, and general well-being assessed daily in efforts to detect early warning signs of the residents being unwell and support early interventions. We're currently securing the supply chain for thousands of units of supplies and meals for the upcoming months, filling the position of staff that may be unable to work or require isolation, obtaining additional transportation for essential workers, and maintaining clear and constant communication with the hospital on potential transfers. Many of these precautions we have seen have been adapted worldwide, but have proved to be no match for complete protection against COVID-19. However, we must not lose heart. We must remind ourselves that the picture would look alarmingly different if we did not take such protective actions and measures. Therefore, this is also a time to remind the community at large of the additional measures that should be taken to protect our most vulnerable, those with health conditions such as severe asthma, cancer, poorly controlled chronic conditions, especially related to heart disease and respiratory illnesses or diabetes. The precautions are called shielding and require these persons to stay home, strictly avoid contact with someone who is displaying symptoms, and anyone coming into their home should wash their hands with soap and water for at least 20 seconds. We know we are all judged as a society on how we protect and support our most vulnerable. Let's all do our best to protect ours. The Ministry of Health is currently working tirelessly to do what we can, but this is all about all of us as a community doing our best. We will be issuing further guidance surrounding the shielding that I just spoke about tomorrow. Thank you, Premier.
Thank you, Minister. On behalf of the government and the people of Bermuda, and also my family, I extend my sincere condolences to the family of the person who passed away today. Sadly, at these press conferences, we refer to our fellow Bermudians as numbers of statistics which are to be reported. But these persons are far more than numbers and statistics. They are someone's father, they are someone's mother, they are someone's friends, they are someone's family. And each of these individuals have been a part of the rich fabric of what makes us a country. We mourn with you, we grieve with you, and we will continue to redouble our efforts to ensure that we can limit the amount of future loss of life. The losses that Bermuda has experienced over the last few weeks underscores the importance of social distancing. As a country, we must stay home and move around as little as possible. We must only leave our homes to visit the grocery store, pharmacy, or gas station for necessities and not for a social outing. Staying in our homes may seem like a simple measure, but scientifically, it is the most effective way to reduce the spread of a highly contagious disease. This Easter weekend, the vast majority of Bermudians adhered to shelter-in-place guidelines, leaving their homes only for those essential items. However, the Bermuda Police Service continues to run into persons who are not taking these restrictions seriously. And there are continued reports of persons who are not doing what they should do. The overall aim of what we are doing as a government in this shelter in place is to save lives by limiting the transmission to ensure that we do not overwhelm our hospital. And the only way that we can do that is by people following the instructions and remaining home. I also want to remind everyone, giving thanks to the grocery stores who have signed on and the other establishments that are requiring persons to have their face covered as they move inside. It is important that if you do go outside, if you are an essential worker, if you're somewhere, please make sure that you wear a face covering. It is particularly important at this time where there are persons who are asymptomatic transmitters of this virus. I did receive a question where someone asks, what does asymptomatic mean? This means that you could don't have a fever, don't have a cough, don't have a sore throat, aren't experiencing any symptoms whatsoever, and are feeling perfectly fine and healthy. However, you may be an unknowing carrier of the coronavirus. And if you are, you could, by an interaction with someone, by some reason you're not sick, so you ended up touching your mouth or something, you did not wash your hands, you did not practice good hand hygiene, and you managed to pass that on to someone else unknowingly. Some of the statistics of which we've seen have said that there are persons who are asymptomatic who are carrying this virus. That is why it is important for all of us to cover our faces when we go out into public. This, unfortunately, is the norm in many countries around the world and will soon become our new normal as we work to make sure that we can continue to combat this virus. As a reminder, we should try to reserve surgical masks or N95s for healthcare workers, but wear any covering that you can, and if you want to learn how to make a covering yourself, you can go on our website, coronavirus.gov.bm, for instructions on how to make your own face cover. If you subscribe to our government WhatsApp, you would have seen a wonderful video received today from the Chief Medical Officer where she discussed this very important issue. Right now, Minister Keynes will give an overview of the Bermuda Police Service and the Royal Bermuda Regiment activities over the past weekend and some other details. Minister?
Thank you, Premier. Over the holiday weekend, the Royal Bermuda Regiment and the Bermuda Police Service, they were deployed across the island. The community advisory points recorded a total of 18,083 stops over the holiday weekend, and the breakdown is as follows. Good Friday, there were 5,056 stops. On Saturday, there were 10,025 stops. And on Easter Sunday, there were 3,002 stops. Over the past week, there were 32 arrests in total. 21 of the 32 arrests were for curfew violations. 11 were for essential movements. In other words, people that were out without a legitimate cause. And the Bermuda Police Service issued 111 warnings for breaches. Over the weekend, the Coast Guard conducted maritime controls in the east and west ends of the island, covering all harbors and most inlets. On Sunday, various vessels, including 10 registered fishing vessels were stopped. Kayakers were intercepted at Abbott's Cliff in Harrington Sound. Swimmers were issued advisories in St. George's for not keeping the shelter-in-place regulations. I want to take this opportunity to remind the public that under the current shelter-in-place guidelines, they are allowed to move about for legitimate reasons only during the hours of 7 a.m. to 7 p.m. Turning to government-run quarantine facilities. Currently, there are approximately 215 individuals in 5 facilities. I wish to extend our appreciation to the Bermuda Police Service Reserve officers who are working with our Disaster Risk Reduction and Mitigation Team, or the DERM, as all of our quarantine locations. I would also wish to take the time to commend the members of our DERM team who for the past 4 weeks have done a yeoman's job in managing these sites, often under incredible demands and strain. Throughout it all, they have demonstrated extreme professionalism, integrity, and as minister, I am very thankful and grateful for their service. This week, the quarantine facilities will continue the essential care package drop-off, which will take place tomorrow, April 14th, and Friday, April 17th. The drop-off time is from 1 p.m. to 5 p.m. Again, the essential care package should contain key items such as toiletries, medications, essential foods, inclusive of all special dietary items. Thank you.
Thank you, Minister Keyes. Part of coping with the effects of a global pandemic is to take care of those persons who have been dislocated economically. What do I mean by that? We have a large number of persons who, due to no fault of their own, whether they worked in tourism or in a business that has been required to be closed, are not able to earn an income because they are unable to work from home and their business is not deemed as essential. I have stated before that this pandemic will cause significant economic damage to our economy, but that does not mean that the government is powerless. We do have the ability to help. Minister Fogel will speak next on the fact that we have provided a significant amount of money to those persons who have, due to no fault of their own, been unable to earn an income. And I'm proud to lead a government that responded very quickly to make sure that persons in need in our community would not starve and would have the resources which they need to survive during this very difficult and challenging time. Minister Fogel.
Thank you, Premier. Good evening to the viewing and listening public. This government has been humbled to do what was necessary to financially assist our fellow Bermudians during this pandemic. Whilst there are a number of applications in train, to date, some 3,811 persons have been paid for a total of just over $3.4 million. Many have received their initial payments, and more will be receiving payments today and on Friday. By Friday, an additional 1,197 applicants will have been paid for an additional cost of $966,000, bringing the total applicants paid to 5,008 persons. Those who have received their unemployment benefit will have received 2 weeks of the benefit, and as the 2-week anniversary approaches, they will be eligible to receive another payment. This will continue until they are either reemployed or the 12-week benefit is up. In this time of uncertainty, the government wants to make sure that no one is going hungry and that no one is being left behind. To further speed up the payments, we have brought in staff from other government departments to assist, and they are working with the larger employers to speed up the application process. We are here to assist and to ensure that no one falls through the cracks. As a reminder, applications can be made online through either the Bermuda Job Board or at www.govt.bm. You do not need to pay a fee to anyone to assist you in submitting an application. There are a number of helpline numbers to call for assistance, and I'll just state them. 297-7714, 297-7716, 707-5439, 707-5438, 707-5440, and 707-542. The numbers beginning with 707 can also be contacted via WhatsApp. Our team in the Ministry of Labor, Community Affairs, and Sports continue to review the submitted applications to ensure that the applicant is eligible. They are approving and processing for payments for those who are. We are working diligently to get these payments to you as quickly as we can. A number of payments have been delayed as applicants have not keyed in their correct bank account details. So please take care when completing your application to ensure that you have keyed in the correct details and have the supporting documents attached to your application. We recognize that there are a number of self-employed Bermudians who are not registered with the Office of the Tax Commissioner, making them ineligible to receive the benefit. We recognize that some of these individuals are struggling financially, and we are currently looking at ways to assist them. For those who are not eligible for the unemployment benefit, there are a number of options available under our consideration. And I just want to make it clear that this government's intention is that no one will go hungry. So please reach out if you are in this predicament and require assistance. Bermuda, we are our brother's keeper. We will get through this together. Thank you.
Thank you very much, Minister Fogo, and I'd like to give tribute to you and your team for working so quickly to